It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. We're going to get today's show started with vein specialist, Dr. Peter Morgan.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much. Even though they say, well, it's not going to hurt, it's not going to hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
A tomato is a superstar in the fruit and veggie categories. Tomatoes contain lycopene, a powerful cancer fighter, and they're rich in vitamin C. The good news is that cooked tomatoes are also nutritious, so use them in pasta, soups, casseroles, and salads. For more information on some of the best doctors in the Houston area and to watch other life-changing stories, log on to bestdocsnetwork.com.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion, and it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Up next, we're going to introduce you to podiatrist Dr. Gabriel Maislos.
Many presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, no pain, it just felt better. And I was so happy, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump because first it gets red, and next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone. I
mean, it's not sore or nothing, it just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. A lot of people are concerned that they've heard from their neighbor or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really 2 weeks of just not putting weight on it, and we've really come a long way with our surgeries.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, it may also boost your immune system, so bring some humor into your life.
Most smokers want to quit, and it's a good idea to quit. I mean, smoking causes cancer, smoking causes heart disease, and oh my gosh, it causes wrinkles too. No one wants wrinkles. So there's 3 particular ways to stop smoking if you use pharmacology. Number one, you can use over-the-counter nicotine replacement products. For example, using the patch that you use every day keeps nicotine in your system all day at a very low dose. And then when you feel like you want a cigarette, you just chew a nicotine gum. This tends to replace a bad nicotine that's hard to get off of, that is cigarettes, with an easier to quit nicotine, and that is the patch or the gum. You can also use 2 different drugs that are available from your doctor to help you stop your cravings and make it much easier to quit. Those are great ideas. Now, the best way, of course, is just to go cold turkey and see how you do. If you fail, don't be surprised. That happens a lot, and it's shown that most smokers need 2 or 3 times to quit. The best thing to do is to dial 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. Those helplines are available to you to help you quit and work wonderful. So quit smoking, you know it's good for you to stop.
For additional medical minutes with Dr. Honaker, head to our website, bestdocsnetwork.com, click on Education and the Medical Minute tab.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varughese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, you know, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Did you know that you can request an appointment with any of the amazing doctors you've seen on our show today? Just head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next physician. It's head and neck surgeon, Dr. C.T. Nguyen.
I was experiencing a sinus, like an ongoing sinus infection for like the past 2 years. I was feeling congestion in my nose and ears and throat, fever, body aches, headache.
Alondra can't breathe through her nose. She feels pressure in her face, her ears, and most importantly, she had this constant postnasal drip that makes her cough all the time.
Constant feeling like you're tired. You know, you're feeling like you got to go to work, but you feel not 100%. And it would also affect my social life because I was always so tired out of feeling sick that I would just decide to just stay in and not really go out.
Upon examination, I noticed that her nasal cavity and sinus are completely blocked. She can't breathe through her nose. And decide upon a plan of treatment that consists obviously of allergy avoidance and allergy control combined with a turbinate coblation. It's a technology using radio frequency to reduce the swelling of the side wall of her nose, increasing her capacity to breathe through her nose and improving her nasal allergy symptoms.
After the procedure, I no longer experienced the symptoms that I was experiencing before. I noticed that I could breathe a lot better, like I just want to say I could breathe.
Alondra was very happy with the result of the treatment. We actually found the cause of the problem and targeted our treatment. Alondra breathed better, she feels better, it's a new person. Medicine has advanced so much that there's always a solution to breathe well and live well. Patient doesn't have to suffer anymore.
I no longer felt congestion. I wasn't getting sick every month because I no longer had that infection inside of like my sinus passages. So I want to say I feel great now.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back in home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A, and after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
Lethargy, just tired all the time. Anxious, couldn't let my mind relax. Paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
In addition to being able to request an appointment with any of our amazing doctors on our website, bestdocsnetwork.com, you can also ask them a question. And you may have a question for our next doctor. It's cosmetic dentist and smile specialist, Dr. Guy Lewis.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
To combat bad breath, use a tongue scraper to remove bacteria from the back of your tongue. Some studies suggest that adding tongue scraping to your regimen may be slightly more effective at eliminating breath odor than just brushing your teeth.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club, and so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, they want to know how I did it, and I'm very open about how I did it. I was like, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
Colleen had a robotic hysterectomy. She had abnormal bleeding after menopause, and that is always a very worrisome sign if a woman experiences.
My cervix was very thick, and above all my symptoms, and because of my age, I'm 62 years old, so it was time.
Now Colleen was potentially a case of uterine cancer, so I decided to do a robotic hysterectomy on her so that if we needed to, we could continue after the hysterectomy looking for cancer in other places.
I was very impressed with Dr. Imtiaz when I came into her office and her staff. They lined all of my appointments up for me. I just couldn't have been happier with her. I knew as soon as I met her that I was going to be in good hands. She explained everything great.
Robotic hysterectomy I usually do for patients who may have other conditions that preclude them from having a routine laparoscopic hysterectomy. Some of these conditions could be a very large uterus, or if we suspect cancer, or if the patient has had multiple abdominal surgeries and we are suspecting adhesions or scar tissue inside the abdomen, or in patients who are overweight.
When I get up in the morning, I think to myself, I just have so much to look forward to because I don't have that pain, that misery, and I have a lot of ambition right now. I'm able to do a lot more things, and I'm not constantly thinking about, oh my God, I don't feel good today.
As a gynecologist, as a surgeon, it makes my day when I see a patient get up and walk out shortly after her surgery. I think it's silly to have somebody bedbound for 6 weeks, not be able to walk around, not be able to take care of her household, when the answer is simple. I know that I can get them up and about and moving and back to their life immediately.
It is so great seeing these doctors really making a difference in people's lives. That's going to do it for today's show of Best Docs Network. And if you have any questions or comments or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thank you for watching, and we'll see you next week.